The severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, which caused coronavirus disease 2019 COVID-19, was first discovered in Wuhan, China in December 2019. This virus infected humans and caused illness from common cold to severe respiratory disease and may lead to deaths. It is a pandemic and is affected the whole world. The COVID-19 infection is spread from one person to others via droplet produced from the respiratory system or infected people, often during coughing or sneezing. According to current data, the time from exposure to onset symptom is usually between 2 and 14 days, with an average of 5 days. The first case of COVID-19 was detected in Malaysia on 25 January 2020. It was traced and detected to be originated from 3 Chinese citizens who previously had close contact with an infected person in Singapore. They had traveled into Malaysia via Singapore on the 24th January 2020 and were treated at Sungai Buloh Hospital. Upon this alarming situation, Minister of Health in Malaysia quickly devised standard guidelines for the management of COVID-19, and 34 hospitals and screening centers were specifically designated in each state of Malaysia. Then the number of cases increased relatively slow until March 2020, where a religious event was held in Sri Petaling, Kuala Lumpur, and the number of cases increased exponentially, and Malaysia became the highest number of positive cases in Southeast Asia.
Yeah, Ma, I'm here.
This is Makcik Rahmah. She is the typical Facebook auntie that believes anything that was posted on Facebook, including hoax. She read news and rumors from Facebook, including the recent outbreak COVID-19. Makcik Rahmah has a daughter who is a university student. The night before her daughter went back to university, they had a little conversation about the pandemic. Her daughter is concerned about Makcik Rahmah, who believes that this pandemic is a kind of agenda.
What are you doing? I've been calling you so many times. Why didn't you answer me? What are you doing, Anga? I'm watching the daily report of COVID-19 cases. Come on, let's watch together.
Bismillahirrahmanirrahim. Assalamualaikum and a very good evening, everyone. So now I would like to give the updates regarding the COVID-19 cases today, 20 May 2021 in Malaysia. Starting with the number of recovery cases for today, across Malaysia is 3,916 people. This makes the total of recovery cases to date is 440,032 with a recovery rate of at 89.4%. For the new cases for today, there are a total of 6,806 cases, where 2 are import cases and 6,804 local cases. This is the highest record that we have ever encountered yet since the first time this pandemic occurred in Malaysia. This makes the total case 492,302. The active cases are 50,171. 587 cases are in ICU and 330 of them need breathing aid devices. For division according to state, Selangor had the highest number, which are 2,277, followed by Kuala Lumpur 655 cases, Johor 616 cases, Sarawak 608 cases, Kelantan 426 cases, Kedah 417 cases, Pulau Pinang 316 cases, Negeri Sembilan 291 cases, Perak 248 cases, Sabah 245 cases, Terengganu 230 cases, 233 cases, Melaka 212 cases, Pahang 157 cases, Putrajaya 35 cases, Labuan 17 cases and Perlis 8 cases. Today there are 24 new clusters happening, which are 9 cluster at working places, 7 community cluster, 6 religious cluster, 1 high risk cluster and 1 educational cluster. That's all for today's report. Please adhere to the SOP. We still have not won yet in this pandemic war. Wear a face mask, avoid crowded places, keep social distancing, and apply hand sanitizer always. That's all. Thank you. Assalamualaikum.
It has been a year since this pandemic. Do you believe in these news and numbers? They might have lied to us, you know. There must be an agenda behind this. We have been living with the virus for about a year now, following what they told us, but still the numbers of cases increase every day. Do you still believe it? See, my friends on I told you, my friend on Facebook has said that all them has agenda. You know, agenda. You should read Facebook.
No ma, this is the new situation and it keep worsen. We need to always be careful and fight to prevent this virus from spreading even more. These cases are increasing to 6,000 and we are reaching 7,000 soon. The hospital are all occupied with COVID patients and many more are under surveillance. Recently, the dead body, of COVID-19 patients are stored in special container and as they are out of space. Please ma, we need to be careful.
Stubborn. This one so stubborn.
Ma, I'm going back to university tomorrow. Since I will leave you alone, please stay at home if nothing urgent. Remember to always wear face mask, practice social distancing as SOP ma. You are senior citizen now. Aduh.
Yeah, I know that.
Not only that, but this pandemic has also affected the environment health too. I think the authorities should evaluate the environmental planning. They should examine this situation and its context. Goals and objectives must be set to tackle this threat. As people have been using face masks without knowing that the right way to dispose of them, they also have been littering the face mask everywhere right now. This affects the environment. Authorities should design a special plan to treat this pandemic waste. For example, people should be taught to dispose of their masks in plastic before throwing them to prevent bacterial infection. Among things, the authorities should provide a special bin to dispose of the face mask.
This one might agree. Some more the PPE that the frontliner wears, they all need to be treated correctly. If not, our environment are in danger. Although the pandemic has reduced the water and air pollution, it comes another threat to the environment. So we need to be wise on this matter. We need to implement the right planning to take care of our environment. Later, the environmental condition can be evaluated on whether their planning is well done or not. So important to always take care of our environment.
True ma, I hope they come with something like schedule waste management, proper waste segregation and education. Most important, the enforcement of laws to secure this matter seriously. But ma, you must remember to always stay at home, okay?
Alright, Mak will try.
The very next evening.
Although Makcik Rahma has been advised by her daughter to limit the physical and social activities, she with her bigoted decisions planning for a shopping spree. As the world struggles to break the grip of COVID-19, Makcik Rahma still thinks that this pandemic is only conspiracy which can trigger the believers with fears and worry. These conspiracy theories can be linked between the beliefs in COVID-19 falsehood and the reliance on social media such as Facebook and WhatsApp chain messages as sources of news and information. Makcik Rahma is ready to go out. She feels so excited to spend her money without acknowledging the dangers that may be awaiting her. This is Najmi. Wow, he must be loaded to shop everything here. But wait a minute, why does the wristband look so familiar? That is not from the latest collection of Habib jewels, but that is the wristband for people who receive home surveillance order. He might be the COVID-19 patient under investigation or PUI. Under home quarantine, but due to his selfishness, he is here. In this situation, Najmi has offended the law by violating his self-quarantine and may be penalties as according to Section 11.5 of the Prevention and Control of Infectious Disease Act 1988 provides that any person who does not comply with any direction issued in accordance with Section 11.3 of this Act can be liable to penalties which are outlined in Section 24. The same Act. If individual breach COVID-19 quarantine, he or she will be fined 10,000 ringgit or imprisonment or both. It turns out that the email received by Najmi is his COVID-19 RT-PCR test, and unfortunately, it is positive. Najmi feels frustrated, sad, and anxious. The droplets can remain suspended in the air or on the surface for minutes to hours. At the same time, Makcik Rahma arrives at the mall and she tries to climb the stair. She holds the contaminated area which may present the virus particles.
Several days later.
Two days have gone by and Makcik Rahma slowly regains her consciousness. She tries to ask the doctor who is clacking her while she is in the hospital. The doctor tries to explain why Makcik Rahma is warded. As Makcik Rahma has calmed down, the doctor informs that Makcik Rahma is tested positive for Covid-19. However, Makcik Rahma is in denial.
Makcik, before you pass out, do you remember how your body feeling? Do you feel you have to work hard to breathe?
Yes, I feel difficult to breathe, headache, sore throat, and extra fatigue. My body feels warm, and I have been coughing recently. I thought I had a cold. All those COVID-19 symptoms, doctor?
Yes, Makcik. People who infected with COVID-19 virus will have high fever, cough, body ache, and as well as lost sense of smell and taste.
Oh, perhaps that is why I had no interest in eating for last few days.
Yes, and the recovery time to get back to normal may require time depends on individual. That's why high-risk groups such as elderly, children, and patients with chronic disease are advisable to be at home during this pandemic, as we do not know where the viruses are. Some infected people may be asymptomatic, but this virus can also cause severe in some people, requiring the ventilation. Therefore, it is important for us to protect ourselves from this COVID-19 virus. And for suggestion, Makcik can request for COVID-19 vaccination. With vaccine, we are not just protecting our health, but we also can protect the health of our loved one, as herd immunity can be established and against this virus. I have to go first, yeah, Makcik. Please remember my advice, and it our responsible to break this chain.
Alhamdulillah, Allah beri peluang untuk hidup lagi. Tak akan aku sia-siakan lagi selepas ini.
Fighting this COVID-19 pandemic is a tough war that requires cooperation from all parties. The government needs to come with a greater solution to overcome this pandemic, and civilians need to follow the guidelines. Although the government has done their best in articulating the SOP, if the civilians are still unaware and ignore this commandment, it is useless. At this trying time, we should prevent ourselves from attending crowded places, and please stay at home always and go out only for necessary things. It is safer for you to always stay at home. Moreover, if you are a person under investigation (PUI), you should adhere to the self-isolation order and never go out of your home and attend crowded places, as it will cause harm to others. In the Quranic verse, chapter 13, Surah Al-Ra'd, verse 11, Allah mentioned, Allah will not change the people's state until they first change their own state of heart and faith. And if Allah wills to torment a people, it can never be averted, nor can they find a protector other than Him. Hence, from this verse, we can contemplate that we need to gear up ourselves and work hard together to fight this pandemic. We need to have the right perspective and view in order to overcome this problem. Moreover, we need to rely on and pray to Allah in order to be success in combating this pandemic. This is because, as in the verse, the hurdle are come from Allah, and it is His will if He wants to give trying times to the people. As a conclusion, we have shown and discussed the scenario and reality that was happening in this COVID-19 pandemic. We hope that this video will be an eye-opener for anyone who sees this and would be enhance our motivation and willingness to fight this pandemic. Thank you.